But yeah, a teacher, somebody that's going to be 18 and older, like a brother, sister, aunt, uncle, just somebody that has care of that individual. And again, that's more just to save yourself legal problems. If you think you need to get in there and act, do that, and then find out who's there to take care of the kid. Okay, the last thing that we really need to discuss is shock. Does anybody know what shock is? Have an idea of shock? I would say most people, when you're thinking of shock, you're going to think about like a birthday party. Walk into the room and everybody jumps out, says surprise, person falls over, they faint. That's going to be one form of shock. They're going to come out of that. You know, they're going to pop back up, they're going to laugh, they should be good. You get other types of shock where you've been injured, the body suffered a trauma, and the body is now trying to compensate for maybe a loss of blood, a head blow, or you've hurt your spine. So what your body is thinking is, my brain, my lungs, and my heart are the most important thing. So I need blood to my brain, my heart, and my lungs. How can I get that? Because I'm losing blood. So your skin will start to become pale because the body's now taking the blood that would normally go to the skin and sending that to the heart, the brain, and the lungs. So first thing you're going to see on a victim is pale, chilly when you're touching them, and maybe some sweating going on. That's going to be your first sign of shock. You want to act when you see this. The sooner you find a shock situation and treat it, the better off you are. Because what's going to happen is, after the body shuts down the skin, if that's not good enough, it's going to start going for reproductive organs. Then it's going to go for the stomach. You don't really need to digest food when you're dying, so then your stomach's going to shut down. If it's still not working, you're still losing blood, or you're still having that head injury or the spine injury, it's going to start going for major organs and just shutting them down one by one. When we don't need the kidneys, now we don't need the liver, till it gets down to the brain, the heart, and the lungs. Then the lungs would go, then the heart would go, then the brain would go. If an organ shuts down, it's no longer getting blood flow, it's going to die, just like any other tissue. So if your stomach stops getting blood flow for a particular amount of time, that tissue, the stomach tissue, may die, and your stomach's not going to work. So what you'll see, if you ever, you read in the paper, somebody was in an automobile accident, they go to the hospital, they're in there for like 2 to 3 weeks, and then you read about them dying, and you're wondering, well, they were in the hospital for 3 weeks, what's going on? They probably bled so much that their internal organs shut down and died, and they've been on breathing equipment and things to help them do those bodily functions, but they can never get their organs to come back on, and so they'll eventually just expire in the hospital. The quicker you stop bleeding, the quicker you notice shock, the better chance you have of saving your victims. What you need to do for shock when you notice it is, with the pale skin, the sweating, the coolness, they're also going to be anxious. They may be kind of walking around just going, what just happened? I was in this accident. My chest kind of hurts. I just don't feel right. Well, if they have any internal injuries from that chest hurting, hitting the steering wheel, as they're walking around, they're bleeding internally, and they're bleeding more because they're moving around. You want to lay them down on the ground. Get them down to the ground, unbutton their shirt. It allows them to breathe a little bit better, maybe even unbutton their pants a little bit, just so they're able to expand their chest as much as they possibly can. They're going to be cold. Again, they're not getting blood flow to the skin, so the skin's going to be getting cold. Find a blanket, find a jacket, something to keep them warm, keep them calm. Does anybody remember from previous classes about lifting the feet? Have you heard that before? You're supposed to get the feet 12 inches up off the ground. They've now, with the new class, they've taken that away as well. They want you to keep the person perfectly flat. What they're concerned about is if somebody has a head injury, you lift those legs up 12 inches off the ground, it pushes the blood up, which is what they're trying to do, get it to the core of the body, but it's also causing intracranial pressure on the brain, and it's causing some brain injury. So they want to keep the person as flat as possible. So that's going to be the big things that you're going to want to worry about with shock. Keep them warm, keep them calm, keep them flat, and kind of get their clothes off a little bit just so they can breathe a little bit better. Are there any questions on that? Feel okay with that section of it for the most part? Okay, what we're gonna do, we'll go ahead and take a break, maybe 5-10 minutes, give you enough time to get down there and get a cigarette. We'll get back up here and hopefully we'll have some coffee. Once we get back up here, we'll start doing the actual CPR portion of it and the chest thrust and back blows. Yeah, see, that'd be a good way to go into shock. Yeah, if you ever see anybody coughing up blood or something like that, you may not see the bleeding on the outside, but you're looking at internal bleeding there. That's the stuff that's the hardest to stop.
He ran
Shooting up
presently
in
in a
shooting.
thread, and he decided to shoot the gun in the air.
He then tried to break into the 5U house.
Yeah.
Like ran around for like 10 minutes trying to break into the doors.
Apparently he was waiting on a taxi and it never came.
Adam said something, he
That
thinks
just
I got
seems
shot.
natural.
I guess that's
Yeah.
the reason to get your gun out. Yeah.
Well, you know, you start firing fast in there, the police show up, and just go, okay, I need to go to.
Yeah.
Why does everybody who does that just assume those bullets like don't come down? There was a kid who died last year because someone fired one at New Year's. It's like, hello, what the fuck is that?
That's why
I
you
was
keep
wondering
thinking about why
about
these Libyan freedom fighters shooting up into the air
Like
when
Jon
they
Stewart
won.
a couple weeks ago was like, get down,
They're
everybody.
gonna fly down. Yeah, it makes a lot of noise, but
Yeah, right.
If you'd have it just at an angle.
Yeah, you just gotta make sure that you shoot it at something other than 90 degrees straight up, you know.
I think the probability
Angle it
of
off to
being
the
exactly
side.
90 would be like astronomical, going exactly straight up.
That distance, it comes down like a half mile away and hits a goat or something. It'll be fine.
Poor goat.
Yeah, that poor goat didn't deserve that, did he?
Probably not.
Get some milk and cheese out of it.
Yeah.
Some kebabs. Should have that kebab place.
Are we all back?
yes.
Okay.
Give me one.
So if you were to come across an emergency, what's going to clue you in that you were actually coming across said emergency? What are like sights and sounds that you might associate with that? Yeah, so smoke, smelling that. Screaming would be a good one. You're going to hear a lot of screaming, helps. And if you're hearing sirens, that's going to let you know that there's an emergency as well. But a lot of times if you're hearing sirens, somebody's activated that system. It doesn't mean that you don't, if you see somebody and you're hearing sirens, you can still approach and do something until they get there. But sirens sometimes are going to be the end of an emergency. Another type of an emergency sound is just complete silence. If you're outside and birds stop chirping and the weather kind of changes and now it's just completely silent, you might be looking at a tornado coming through. If you're at a playground and you're hearing kids playing and then all of a sudden you don't hear anything, with a kid, they're getting in trouble or they're dead. So you want to make sure that something's going on because kids are never quiet unless something's wrong. So playground gets quiet, that's going to be an emergency as well. Breaking glass, squealing tires, all things like that. So that's what you're going to be looking for your emergencies. Do you remember how long we're going to be doing our look, listen, and feel with our victims?
10 seconds.
10 seconds. What are our 3 C's?
Check, call, and care.
Okay.
What were they?
Check, call, care.